been made really child-friendly. All those pictures and animals and smiles that you're seeing are supposed to calm your children when they come in. The children won't be scared anymore with plain walls and, you know, just plain beds. They will walk into a space that they smile, and within no time they're already having their surgery. And that is a very significant part of what we do, taking care of the emotional part of our children's lives. So this operating room that you're seeing here has over 3,000 state-of-the-art equipment, and each equipment is for a specific, you know, intervention. So that tells you how many children you'll reach out and the kind of investment that has been done. Each of those equipments has been, you know, looked at by professional, and also the area that we are serving to ensure that it serves the children, and those skills that are around here are able to utilize it. You've had the cost of the operating room. We have not stopped investing. We will bring in a data collector who we will remunerate every month. We will ensure that every data is collected that is relevant for you as a hospital here to show the impact of having a dedicated operating room. So the data will be collected. You will have to second the person who we will work with to do that, and you will show impact. So what am I saying? This is the first project that we are doing with Smile Train in Kenya, and this is a pioneering project for us. You are the trend setters for this country. That said, our vision is that all the other counties will come to this hospital to learn and see what you're doing, so that they can go and do the same in their counties. And for that, kudos to everyone. We see also that this center, this state-of-the-art operating room, is going to be a center of excellence. One, we will ensure that it has all the skills that we will work with the hospital administration to ensure all the skills that are required are available. Secondly, we will support you in all ways to ensure at some point you are a training center for pediatric surgery and pediatric anesthesia. So we see this as a very, very strong training ground that is going to produce many anesthesia providers and surgeons for this country. To conclude, I want to thank all of you. We are very, very grateful for the leadership at the county government level, the leadership at the hospital level that was very, very supportive when we were delivering this project. And we thank you for allowing us to serve you in this manner. I will end by saying God bless the people of Makueni, and God bless the children of Makueni. Thank you very much.
So now I take this opportunity to invite Smart Train. Jane, please talk to us. Thank you.
Asante sana. The Governor of Makueni County, Professor Kivuta Kibwana, Director Medical Services, Dr. Patrick Ndolo, Chief Medical Officer, Dr. Musyoki Kibwana, Senior Medical Superintendent, Makueni County Referral Hospital, Dr. Joseph Masila, Kids Operating Room Director, Rosemary Mukwe, Belarisu Foundation CEO, Dr. Martin Kamau. That was a very long list. Distinguished guests, ladies and gentlemen, all protocols observed. Good afternoon. I am a storyteller, and so most of the time when I want to speak, before I get to my real speech, I'd like to start with a story. And this time it's about a lady that I met in Bungoma County. We went to one of the hospitals that we work with, just like the way we work with Makueni County Referral Hospital. And this lady had come in for surgery. But what was unique about her is she was very old. She had a hair full of white hair, head full of white hair. And one of the things that the doctor asked her is, number one, why would you want to have this cleft surgery done when you have lived a long life already? And number two, what is it that you have always wanted to do and you never did because you had a cleft? And so to answer the first question, the lady said, you know, I have dependents and I have children, I have grandchildren, but I would not want to die with this being the face that they remember me by. And number two, in terms of what I have always wanted to do, is I've always been seeing people drinking soda from a straw. And I have never been able to do that. And this is what I would want to do. You can imagine the gravity of that situation. You know, when we talk about cleft patients, we talk about the stigma that they face from the community. We talk about the challenges they have in eating, in breathing, in speaking. But you don't think about the small details, and those are what matter, because I mean, you go to a local kiosk, unaenda tu pale kwa muli, unaitisha soda, anakupatia soda na straw, because I mean, it's what we do. Na wewe unachukua tu soda, unaeka straw, unakunywa without even thinking, because it's just something that we do. But now imagine there's someone who's probably looking at you and thinking, I wish I was able to do that. And so I just want us to understand the kind of challenges that our patients face. And just by this one intervention, you change a life. Our focus in Smile Train is mainly on the children because they're the ones with a longer life ahead. And so when you treat a child, then it means that they get the same kind of opportunities that any child born without a cleft is able to get. And they are able to lead full, productive lives. And so, I think my microphone is falling. And so, we don't say that when you're older, your time is over. No. We help all the patients to be able to receive free cleft surgery. And now I'll go to my speech so that I don't forget any important thing. For those new to Smile Train, we are a global international children's charity. And what we do is focus on children born with cleft lip and palate. And like I said, we focus a lot on the children because they're the ones that when you impact them, then their life is you know, they have a full productive life. But we also take care of adults. And how we work is very different from other organizations that you're going to hear about, you know, because we work with the local medical professionals, we work with the local hospitals, and we provide care to every patient that is not able to afford this care. And in areas especially where we do not have the capacity in terms of the infrastructure or the medical resource, the human resource, then we are able to help in training so that eventually this program is adopted at the local level and accessibility to care for that patient. They don't have to wait, oh, unajua daktari wanakuja April na August, so wewe ukikuja July pole hatuwezi kukusaidia. Hapana. What we are looking at is if that patient walks into the hospital at any one point, if they are fit for surgery, if they are fit for speech therapy or any other care that we are able to offer, then they get that care as soon as they need it, and they don't have to wait for so long. And so we have been operational for 22 years, since 1999. In Kenya, tumekuwa hapa kuanzia 2002. Our first partner hospital was in Nairobi. And so far, since 1999, when Smile Train was founded, we have been able to reach over 1.5 million patients. Here in Kenya, we are close to 11,000, including the ones that have been operated here at Makueni County. And we still have a huge journey because the backlog is estimated to be in the tens of thousands in Kenya. And we are willing to walk the journey to just make sure that every patient found with cleft is able to receive treatment and receive it in a safe and quality manner. Cleft is a stigmatizing birth difference, and we've heard from our sister who's talked about the myths and misconceptions around cleft care. Unajua, utasikia ni uchawi, utasikia ni witchcraft, Mungu hakukuwa happy na wewe, ama kuna kitu ilifanyika na wazazi ndio wakapata mtoto ambaye ako na cleft. But it is a congenital malformation that can happen to anyone. Actually, the estimate is that in the Caucasian countries, in the US, in Europe, the incidence rate is higher than here in Africa. But because of the education, because of the lack of education that is there in the community, that's why we have all these misconceptions and we stigmatize cleft patients a lot. And so even as we work to help these cleft patients, it's really important that we also continue offering education to the community to just let them know that these are patients like any other. We need to support them, and we need to encourage the health-seeking behavior of these patients, because when we stigmatize them, sometimes they don't even want to go to hospital, and we need them well. And someone just said that they could be the future leaders of Makueni County. And so also my call to the community is, let us really appreciate these patients and help them so that they can be able to get the treatment that they require. Given the anticipated population growth in Africa, there is really a significant need for pediatric surgical interventions. It's estimated that about 85% of children in Africa are likely to undergo some form of surgery before they get to 15 years. And in pursuit of the universal health coverage, the World Health Assembly mandates member states to ensure that emergency and essential surgical services are integral components. This resolution is born out of deep research findings on health equity and inequality to the larger part of humanity, as well as the sustained impoverishment due to out-of-pocket expenditure on healthcare without getting appropriate or commensurate outcomes. Imagine how many hospitals in remote areas are not able to carry out essential surgery for different reasons, such as poor funding, human resource challenge, and infrastructure decay. So today marks a huge victory for all children, including the ones that we support, the children born with cleft, who are in dire need of timely and quality pediatric surgery. And we join hands with the Scottish charity of KidsOR to unveil the newly refurbished pediatric theatre that will benefit communities in Makueni County and even beyond. In 2020, Smile Train and KidsOR came together and committed to supply an initial 20 pediatric rooms across Africa, providing essential life-saving surgical care to more than 12,000 children born with cleft by the end of 2021. As we open the doors to Makueni County Referral Pediatric Theatre, we recognize that this helps ease the burden for referrals to our national hospital by localizing this much-needed surgical care here in Makueni County. In efforts to strengthen human resources for health, Smile Train is passionate about advancing education and training for cleft professionals, including all the spectrum of medical professionals we work with, including surgeons, anesthetists, nurses, orthodontists, speech therapists. And we are inspired by the interest of cleft fellowship that we are starting with some of our partners, West Africa College of Surgeons and COSEXA. Here in Kenya, we have also partnered with the University of Nairobi, and we are offering scholarships to surgeons across Africa who wish to pursue plastic and reconstructive surgery. 2 slots every year are allocated to Kenyans, and we also have gender equality. And so for the 2 surgeons who benefit in Kenya, one is a man, one is a woman. Further, a lot of our efforts towards providing quality care have been hampered by lack of quality data. And so we are also working with KEMRI, the Kenya Medical Research Institute, to be able to get empirical data that will inform us on where the need is and where to focus our resources in the coming years. And as I conclude, we recognize the change in priorities ranging from the impact of COVID-19 and refocusing of health workforce and investment in response to COVID. We have a duty of care to the patients from low resource settings, and they should not be left behind. Let us keep our eye on the goal of safeguarding the country's future by investing in surgical and anesthesia care for children. I sincerely would wish to appreciate the Makueni County government, led by His Excellency Professor Kivuta Kibwana, for the unwavering support to the Smile Train Belarisu Cleft program in the country. I would like to thank our partners KidsOR for partnering with us on this milestone initiative that will greatly improve the safety and quality of care that we provide. And I would also wish to appreciate and thank our partners, Belarisu Foundation, for walking the journey with us in increasing accessibility to cleft care for patients in Makueni County and even beyond. Finally, I would like to thank Makueni County Referral Hospital Fraternity for believing in our dream and helping bring our vision of ensuring persons with cleft are no longer left behind in receiving care closer to their doorsteps. Thank you very much.
And now I want to request His Excellency the Governor to talk to us. Welcome, Your Excellency.
Kwa sababu tuko katika hospitali, huyu bwana Mwendwa amefunga hii microphone yake na inahitaji bandage. Kwa hivyo naona ndiye ameingia mambo ya hospitali ya kutumia bandage. Rosemary Mugwe, Africa Director, KidsOR, Jane Ngige Muturi, Director wa East Africa wa Smile Train program, any representative of Belarisu Foundation who may be here, waziri wetu